topic is one that no family can afford to miss. Today, in this one day, 40 people will die from a prescription painkiller overdose. Not alarmed? Get this. More people die every year from prescription drug overdose than cocaine and heroin combined. And now, as a controversial new pain med hits the market, some doctors fear those numbers might just rise.
So Hydro is 10 times stronger than Vicodin and could be potentially deadly.
There are growing calls to pull a new super pain pill back off the market.
This is a drug dealer's dream.
A new opiate painkiller with 5 to 10 times the power of Vicodin has ER doctors worried about a disastrous spike in overdoses and deaths.
One pill will kill a child.
The FDA approved the drug even though its own advisory council voted 11-2 against it.
A protest today over a potent new painkiller.
If it's crushed, it can be snorted, it can be liquefied and injected.
No to Hydro!
Kara Roan says she lost her daughter Nicole because a doctor overprescribed a cocktail of 3 opioids.
It's too late for me, but it's not too late for other parents.
We're sitting on an explosion that's about to happen.
So the question becomes, did Massachusetts get it right? Should Zohydro be banned? Or is this a medication a huge advance for millions of Americans who are living in chronic pain? In this doctor's special report, we're going to give you the risks and realities of the drug Zohydro. And joining us now via Polycom is pain management specialist Dr. Gregory Smith, who's in Washington, D.C., where you admit you're lobbying against Zohydro. So, Dr. Smith, first things first, as a pain management expert, just give us some of the stats on what this drug is and what it's designed to do.
So Hydro is, how can I put this? It's like throwing gasoline on a bonfire, and I think that this drug will make the OxyContin epidemic look like child's play. The 50 milligram strength is the equivalent of 10 Vicodins. It can be crushed, it can be snorted. There's absolutely no anti-tampering devices in this medication. It is incredibly dangerous, in my opinion. The drug does have a place in the market, but what they need to do is take it back and reformulate it. And the people that make this drug already know this. They're already in the process of reformulating the drug, but it's going to take about 2 years to get it on the market. So the motivation here is to get the drug out there to recoup the money that's been spent on the drug. And there's so many medications already in the market to treat chronic pain.
The reality is, for decades now, doctors have unwittingly put folks on these medicines, and they've become addicted many times without us knowing it. And when you look at the stats, opioid painkiller abuse in the U.S. is up 343% since 1990. Painkiller deaths have tripled in the past decade. So this is a true epidemic. And we all would agree then that one of the big things is trying to prevent tampering, which if you can crush a drug and snort it and it gives you an immediate high, it has a higher abuse potential. And so some of this also, would you not agree, Dr. Smith, and also to the rest of the docs, it's teaching people and coaching them and doctors about the abuse potential. Because I have a lot of doctor friends who are in emergency medicine who are really not afraid to write a lot of these prescriptions. And I'm terrified of it. I'm someone who I've always been very careful
you know,
with.
We see more and more patients come in all of our practices on something. It's scary how savvy patients are on the use of opiates, whether it be Vicodin and Percocet.
But, you know, I place the onus of responsibility on the healthcare provider. It's not the poor patient who's in pain. It's not their responsibility to manage and make sure that there is not addiction or dependence. It's the healthcare provider.
And so with chronic pain, there's going to be dependence.
Right, but there are medications that are much safer, as I'm sure Dr. Smith can attest to, much safer. And I think that we've all heard about this before, the patient who goes doctor to doctor and says, I need this prescription, I need that prescription. There has to be some centralized record.
We can't be police. Our job, my job as a primary care physician, is to provide relief for someone in chronic pain.
Which is 1 out of 3 people.
Sure. And so at the end of the day, I understand that with opiate use, there's going to be dependency. That's just part of it. That's just part of the process. So, I mean, at what point do we say we're worried about the patient and their chronic pain versus trying to be the police? And
well, is there a way to treat pain without getting to the point where people are just so addicted like they are now and dependent to the point where deaths tripling in a decade, unacceptable?
Right. Well, there's a difference between dependence and addiction. You know, I've treated chronic pain patients for the last 20 years, and there's a fine line between that. But here's the thing that people have to understand. About 90% of the prescription narcotics that are diverted, meaning that they're used for non-medical reasons, they get them from relatives, friends, family, going to people's medicine cabinets. So even though we can't be the drug police, the reason why you don't want to have drugs like this on the market with no anti-abuse mechanisms is because ultimately they're going to end up in somebody's medicine cabinet, they're going to end up in somebody's car or purse, and a child can pick it up and take it and chew it up and overdose. These are the dangers, and this is why this drug needs to be recalled until it has anti-abuse mechanisms put in the pill.
And that's one of my biggest fears as a pediatrician. I'm probably never going to write a prescription for this myself, but my patient's parents are going to have it in the medicine cabinet, and the teens are going to go into that cabinet, get a couple of those pills, go to a pill party. Those pills get passed around. You know, there may be the regular ones getting passed around that people maybe have taken before, the Vicodin, and that they're comfortable with, but it's Russian roulette. Who's going to end up with that one Zohydro that could kill them?
Well, and we all believe in treating pain. And Dr. Smith, thank you so much for joining us. We really do appreciate it. Thank you very much.